Nutrition Science, Nutrition in Older Adults. The senior years are the period from age 51 until the end of life. A number of physiological and emotional changes take place during this life stage. And as they age, older adults can face a variety of health challenges. Blood pressure rises, and the immune system may have more difficulty battling invaders and infections. The skin becomes thinner and more wrinkled and may take longer to heal after injury. Older adults may gradually lose an inch or two in height, and short-term memory might not be as keen as it once was. However, many older adults remain in relatively good health and continue to be active into their golden years. Good nutrition is important to maintaining health later in life. In addition, the fitness and nutritional choices made earlier in life set the stage for continued health and happiness. The dietary reference intakes, or DRIs, vary based on age. Beginning at age 51, nutrient requirements for adults change in order to fit the nutritional issues and health challenges that older people face. Because the process of aging affects nutrient needs, some requirements for nutrients decrease as a person ages, while requirements for other nutrients increase. We will take a look at the changing nutrient requirements for older adults, as well as some special concerns for the aging population. Nutrient needs in older adults. Energy and macronutrients. Due to reductions in lean body mass and metabolic rate, older adults have lower calorie needs than younger adults. The energy requirements for people ages 51 and older are 1,600 to 2,200 calories for women and 2,000 to 2,800 calories for men, depending on activity level. The decrease in physical activity that is typical of older adults also influences nutrition requirements. The AMDRs for carbohydrates, protein, and fat remain the same from middle age into old age. Older adults should substitute more unrefined carbohydrates, such as whole grains, for refined ones. Fiber is especially important in preventing constipation and diverticulitis, which is more common as people age, and it may also reduce the risk of colon cancer. Protein should be lean, and healthy fats, such as omega-3 fatty acids, are part of any good diet. Micronutrients. The recommended intake levels of several micronutrients are increased in older adulthood, while others are decreased. A few nutrient changes to note include the following. To slow bone loss, the recommendations for calcium increase from 1,000 milligrams per day to 1,200 milligrams per day for both men and women. Also, to help protect bones, vitamin D recommendations increase from 600 IU to 800 IU per day for men and women. Vitamin B6 recommendations rise from 1.7 milligrams per day for older men and 1.5 milligrams per day for older women to help lower levels of homocysteine and protect against cardiovascular disease. Due to a decrease in the production of stomach acid, which can lead to an overgrowth of bacteria in the small intestine and decreased absorption of vitamin B12, older adults need an additional 2.4 micrograms per day of B12 compared to younger adults. For elderly women, higher iron levels are no longer needed post-menopause, and recommendations decrease from 18 milligrams per day to 8 milligrams per day. Common health concerns in older adults. Older adults may face serious health challenges in their later years, many of which have ties to nutrition. There's an increased occurrence of cancer, heart disease, and diabetes. Loss of hormone production, bone density, muscle mass, and strength, as well as changes in body composition, increase of fat deposits in the abdominal area, increasing the risk for type 2 diabetes and cardiovascular disease. There is an increased occurrence of dementia, resulting in memory loss, agitation, and delusions. Decreased kidney function, becoming less effective in excreting metabolic products such as sodium, acid, and potassium, which can alter water balance and hydration status. There's a decreased immune function, resulting in more susceptibility to illness. There is an increased risk for neurological disorders and psychological conditions, such as depression, influencing attitudes toward food, along with the ability to prepare or ingest food. Dental problems can lead to difficulties with chewing and swallowing, which in turn can make it hard to maintain a healthy diet. Lower efficiency in the absorption of vitamins and minerals, and being either underweight or overweight. Nutrition concerns for older adults. Dietary choices can help improve health during this life stage and address some of the nutritional concerns that many older adults face. In addition, there are specific concerns related to nutrition that affect adults in their later years. They include medical problems such as disability and disease, which can impact diet and activity level. Sensory issues. At about age 60, taste buds begin to decrease in size and number. As a result, the taste threshold is higher in older adults, meaning that more of the same flavor must be present to detect the taste. Many elderly people lose the ability to distinguish between salty, sour, sweet, and bitter flavors. This can make food seem less appealing and decrease appetite. The intake of foods high in sugar and sodium can increase due to an inability to discern those tastes. The sense of smell also decreases, which impacts attitudes toward food. Sensory issues may also affect digestion because the taste and smell of food stimulates the secretion of digestive enzymes in the mouth, stomach, and pancreas. Dysphagia. Some older adults have difficulty getting adequate nutrition because of the disorder dysphagia, which impairs the ability to swallow. Stroke, which can damage the parts of the brain that control swallowing, is a common cause of dysphagia. Dysphagia is also associated with advanced dementia because of overall brain function impairment. To assist older adults suffering from dysphagia, it can be helpful to alter food consistency. For example, solid foods can be pureed, ground, or chopped to allow more successful and safe swallowing. This decreases the risk of aspiration, which occurs when food flows into the respiratory tract and can result in pneumonia. Typically, speech therapists, physicians, and dietitians work together to determine the appropriate diet for dysphagia patients. Obesity in old age. Similar to other life stages, obesity is a concern for the elderly. Nutrition science. Nutrition in older adults. The senior years are the period from age 51 until the end of life. A number of physiological and emotional changes take place during this life stage. And as they age, older adults can face a variety of health challenges. Blood pressure rises, and the immune system may have more difficulty battling invaders and infections. The skin becomes thinner and more wrinkled and may take longer to heal after injury. Older adults may gradually lose an inch or two in height, and short-term memory might not be as keen as it once was. However, many older adults remain in relatively good health and continue to be active into their golden years. Good nutrition is important to maintaining health later in life. In addition, the fitness and nutritional choices made earlier in life set the stage for continued health and happiness.